Fundamental Principles of Care Coordination. Hello, my name is LaTanya Arrington, and I am here to educate you on care coordination. But first, let me start by sharing my background. I am a registered nurse of 2 years. I have spent most of my time working in inpatient neuro. As of 2 months ago, I transitioned to a hematology oncology clinic at a cancer institute where I coordinate patient care. In this position, I coordinate everything from making sure that the patient gets blood transfusions, chemo plans, consents, and anything from getting resources to get to and from their appointments, and also PET scans. Effective care coordination forms the foundation of high-quality, patient-centered healthcare. This approach centers on the collaborative organization of services and information among various care providers, patients, families, and community resources to achieve optimal healthcare outcomes. Attention to ethical considerations ensures that patient autonomy, privacy, and equity are upheld throughout the care process. At the same time, awareness of policy issues enables healthcare professionals to navigate regulatory contexts and advocate for improved healthcare practices. Integrating accessible community resources into care planning strengthens support networks and addresses social determinants that influence patients' well-being. By grounding practice in these fundamental principles, care providers are positioned to address the diverse and evolving needs of individuals across the care continuum. Principles of care coordination. Among the fundamental principles of care coordination, the effective integration of community resources, adherence to ethical norms, and navigation of policy issues remain essential to supporting optimal patient care. Collaboration across various sectors enables the care teams to address a wide variety of patient needs, particularly those sustained partnerships with community organizations and interprofessional networks. Kateri et al., 2023. Upholding ethical standards such as patient confidentiality and equitable access guides providers in making decisions that honor individual rights while fulfilling professional responsibilities. At a systems level, organizational priorities like strong technology platforms and transparent accountability structures are critical for supporting seamless communication and ensuring that policy guidelines are enacted effectively. Simpson et al., 2022. As healthcare systems implement these principles, their continual assessment and improvement of strategies strengthen the capacity to deliver responsive, coordinated, high-quality, patient-centered care. Strategies for patient collaboration. To facilitate optimal health outcomes, care teams must organize strategies to promote active collaboration with patients and families, tailoring interventions to individual needs and contexts. Comprehensive patient education, particularly drug-specific interventions, equip patients and caregivers with knowledge about medication regimens, potential adverse effects, and proper administration, thus reducing error rates and enhancing adherence. Simpson et al. 2022. Addressing cultural competence remains equally important. Providers who demonstrate respect for cultural values and communication preferences help build trust, ensure shared decision-making, and minimize misunderstandings that can compromise care. Evidence demonstrates that when healthcare systems prioritize accessible educational materials and embed culturally sensitive communication frameworks within their workflows, both patient satisfaction and adherence increases. Simpson et al. 2022. Additionally, integrating structured communication channels such as regular family conferences and collaborative care meetings further reinforce these strategies by affording opportunities for clarification, feedback, and the respectful navigation of sensitive topics. Bahager et al. 2020. Additionally, managing change within healthcare systems remains a fundamental determinant in shaping both patient experience and the ongoing delivery of high-quality, patient-centered care. Effective change management entails the systematic introduction of new protocols, technologies, platforms, or care models, all while prioritizing clear communication and responsive leadership to minimize patient disruptions during transactions. Qatari et al. 2023. Successful initiatives also involve engaging the patients and families early in the process to address concerns, clarify expectations, and support strategies in line with unique needs. Organizational readiness, including provider training, multidisciplinary coordination, and evaluation of mechanisms, fosters an environment where change produces enhanced community, safety, and satisfaction. When executed, these processes support the seamless integration of innovations in a manner that maintains not only trust, but advances the core goals of coordinated, individualized care. Qatari et al. 2023. Ethical decision-making and care plans. A central rationale for coordinated care plans rests on the imperative to make ethical, sound decisions that honor patients' values, preferences, and rights across complex care scenarios. Ethical decision-making in clinical settings is supported by structured frameworks, such as professional code of ethics, which guides practitioners through challenging dilemmas by clarifying priority principles and responsibilities. Nelkin and Fornari 2023. In practice, incorporating enhanced communications and early palliative care intervention also allows care teams to proactively identify patient priorities, navigate uncertainties, and address sensitive topics, thereby fostering ethical care coordination. Bahager et al. 2020. The integration of these approaches minimizes the risk of moral distress among providers, alleviates conflicts, and ensures that assumptions about patient interests are critically examined and addressed through collaborative dialogue. Ultimately, grounding coordinated care plans in ethical reasoning directly contributes to transparent, trustworthy care and aligns clinical actions with both organizational values and expresses the need of diverse patient populations. Furthermore, healthcare policy provisions exert considerable influence on both the patient outcomes and the quality of patient experiences by shaping the structure and the process of care delivery. For example, regulations governing care coordination mandate integration across service providers, promote multidisciplinary collaboration, and allocates resources for information technology systems that enhance communication and continuity of care. Katori et al. 2023. These provisions can lead to improved access, reduce fragmentation of services, and increase patient satisfaction through transparent procedure and clear accountability pathways. However, policy constraints or insufficient resourced materials mandates may introduce unintended challenges such as administrative burdens, inequities in service access that undermine the intended benefits. Strong evidence highlights that the well-designed policy frameworks, when supported by organizational readiness and clear ethical guidelines, can positively transform care processes while safeguarding patient interests and minimizing systemic barriers. Nelkin and Ferrari, 2023. In conclusion, the NURS upholds a vital position in successful coordination and continuum of care, drawing upon established principles, collaborative strategies, and reflective practices to respond to patient needs. Through ongoing communication with patients, families, and interdisciplinary partners, the NURS ensures that care plans remain responsive, achievable, and aligned with patients' values across all settings. The application of ethical decisions making serves as a foundational anchor, guiding complex and clinical judgment and safeguarding the interests and the rights of diverse patient populations throughout the care process. Moreover, awareness of relevant policy provisions enables nurses to navigate regulatory requirements efficiently, advocate for resource equity, and identify opportunities for system improvement that benefit both the patient and broader communities. By integrating these elements, nurses significantly enhance the patient experience, advance positive health outcomes, and contribute to a safer, more equitable, and patient-centered healthcare system. That is all for my presentation. I hope that you enjoy, and thank you for listening.